CPR. When normal breathing has stopped, CPR can give someone their life back. The good thing is that it's simple to learn. In this program, you will watch as CPR skills are demonstrated and then have a chance to practice along with the video. Your instructor is a vital link between the mannequin in front of you and the video training. While you're watching, this CPR professional may give you individualized coaching to help you achieve the best results during practice. Skills are divided into two main sections. The first teaches the basics, pumping and breathing. The second section covers when to do CPR. This will help you understand when it's necessary to help someone and what important steps to take prior to starting CPR. Please note that although personal barrier devices like gloves and face masks are always recommended, you won't see them here. Not only is it easier for you to practice without them, but it's also fine to give CPR in an emergency without them. The risk of infection is very, very low. Let's get started. If you are not already seated next to a mannequin, sit down and get ready to learn skills that could save a life. Sit comfortably while skills are demonstrated. You'll be prompted to get ready for the practice sections. The key reason for CPR is to circulate oxygen to the brain. Pumping the chest acts in place of a beating heart. It's essential to get the speed and force of the pumping right. Watch as this basic skill is demonstrated. You'll practice it in a minute. To pump, our rescuer kneels next to the mannequin and places the heel of his hand in the center of the chest. He puts the other hand on top and interlocks his fingers, then moves his shoulders directly over his hands with arms straight. The rate of pumping is very fast. It's equivalent to 100 to 120 compressions per minute. Let's listen to that rhythm. A full cycle of pumping is down and up 30 times. It helps to count it out loud. Let's see a cycle.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now, let's practice pumping along with the video. Kneel next to the mannequin with your knees against the side of the chest. To pump, you'll use the heel of your hand. Place it on the center of the chest. Be careful not to press on the tip of the breastbone. Put the heel of your other hand on top of the first. Lift your fingers and interlock them. Only the heel of your hand should be in contact with the chest. It should be in direct contact with the breastbone. Move your shoulders forward and straighten your arms. This is what you should look like when your shoulders and arms are in the correct position. Now, push down firmly with the heels of your hands at least 2 inches for adults. Avoid excessive compression. Then let the chest come all the way back up by removing your weight from the chest. Avoid leaning on the chest between compressions. Pumping should move down and up smoothly. Don't jab. Get ready to do a 30 pump cycle in time with the on-screen rescuer. You should count out loud too. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Don't be afraid to push hard and fast.
17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Sit back. Remember, pumping is fast and forceful, and when your shoulders are over the heels of your hands, you won't tire as quickly. If you've witnessed an adult go into cardiac arrest and help is on the way, you can perform CPR by pumping the chest continuously without breaths. If you're able, you should give rescue breaths. We'll go over that in the next section. Now, let's practice pumping again. Kneel next to your mannequin, knees against the chest. Place the heel of one hand on the breastbone. Interlock the fingers of your other hand. Move your shoulders over the mannequin and straighten your arms. Get ready. Count out loud with the video. Okay? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17,
Keep your arms straight and maintain the rhythm.
21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, relax. You'll get additional opportunities to practice pumping in this program. Breathing is included for effective CPR.
25, 26,
A full
27,
cycle of
28,
CPR
29,
is 30 chest compressions, followed by 2 rescue breaths. The cycle repeats: 30 pumps,
1, 2, 3,
2 breaths, until the person wakes up, an AED is available and ready to be used, or additional help arrives. Relax and watch as our rescuer demonstrates breathing. You'll practice it afterwards. First, he needs to open the airway, tilt the head back and lift the chin. Then he pinches the nose and places his mouth around the person's mouth, creating a seal. He gives 1 breath lasting about a second. He watches from the corner of his eye to confirm that the chest rises as air goes in. He releases the seal on the mouth and lets the air flow out. Then quickly seals it again and gives another breath. This is done faster than you might imagine. Watch the demonstration again in real time. It's important to give breaths quickly and get back to chest compressions with the least amount of time in between. Now is a good time to review barrier devices. Although there have been no known transmissions of disease from mouth-to-mouth contact, barrier devices should be used if possible, but don't delay CPR in order to get one. The 2 most common types of barrier devices are pocket masks and face shields. A pocket mask is positioned on the person's face over both the mouth and nose. Make sure a face shield is well sealed to the face. You will still need to pinch the nose and get a firm seal around the mouth. Now, let's have you practice breathing. Kneel next to the mannequin's head. Put the palm of one hand on the mannequin's forehead and tilt the head back. With the fingers of the other hand, lift the chin. This opens the throat to allow air to get into the lungs. Use the hand on top of the head to pinch the nose. Open your mouth wide and cover the mannequin's mouth completely with yours. Take a normal breath and blow air into the mouth. It's a quick breath of air with sufficient volume to make the chest rise. Remove your mouth from the mannequin. Take another breath yourself. Now, breathe into the mouth again. Take your hands off the mannequin and sit back. This time, let's do it at the recommended pace for CPR. Tilt the head and lift the chin. Pinch the nose. Give breath. Give breath. Remove your hands from the mannequin and sit back. Now let's practice it again. Tilt head and lift chin. Pinch nose. Breathe 1. Breathe 2. Sit back. If you hear a hissing sound when you blow, air is leaking out from the nose or the mouth. Be certain the nose is pinched firmly and the chin is lifted. You may also need to open your mouth wider to get a tight seal around the mannequin's mouth. If you don't see the chest rise during a breath, retilt the head and try again. If it still isn't rising, you'll need to check the airway and remove any obstruction you see. Now let's practice it again. Tilt head and lift chin. Pinch nose. Breathe 1. Breathe 2. Relax. Remember to watch for the chest to rise from the corner of your eye. Let's do it one more time. Ready? Begin. Breathe. Breathe. Okay, sit back and relax. When we put breathing together with pumping, you'll give 2 breaths after every 30 chest compressions. You've got the basics of CPR. Now let's put them together, pumping the chest and rescue breathing. Kneel next to your mannequin and get ready to practice. Position your hand on the center of the chest. Lock fingers together. Move shoulders over the chest with your arms straight. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Keep your shoulders in position
16,
over your hands and push down hard with your arms straight.
21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt head, lift chin, pinch nose. Make a seal over the person's mouth with yours and breathe 1. Breathe 2. Pump.
1, 2, 3, 4, 5, 6, 7, 8.
Press
9,
down smoothly.
10,
Don't jab.
12,
Let the
13,
chest come all the way back
15,
up.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt, lift, pinch. Breathe 1. Breathe 2. Sit back for a moment. Now, let's do it again. Remember, it's essential to move quickly between pumping and breathing. Position hands on the breastbone. Get ready to count out loud. Now, pump.
1, 2, 3, 4, 5,
Hard and
6,
fast.
7,
Push
8,
down at least 2 inches.
10, 11, 12, 13, 14, 15, 16, 17,
Let the chest recoil
18,
between
19,
pumps,
20,
but keep your
21,
hands in
22,
contact with the
23,
chest.
24, 25, 26, 27, 28, 29, 30.
Give breaths. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22,
Stay strong.
23, 24,
Keep pace with the
25,
video.
26, 27, 28, 29, 30.
Give breaths. Okay, relax. On a real person, you would keep doing CPR until the person wakes up, an AED arrives and is ready to use, or emergency personnel take over. Now that you know the essentials of CPR, let's talk about when to do it. Watch while our rescuer demonstrates the steps to take before pumping and breathing. If he finds a person who looks unconscious, he must decide if CPR is needed. First, he checks for responsiveness. He taps the person and shouts.
Hey, are you okay?
At the same time, he is also noting whether the person is breathing. A person with abnormal or absent breathing needs CPR. If there's no response, he moves to the next step. Call for help. This is essential. The faster help arrives, the better the chance of survival. If possible, our rescuer will direct someone else on the scene to call 911 and get an AED unit. He picks a specific person and gives explicit instructions.
Sue, call 911 and get an AED.
But if no one else is available, the call still needs to be made first. For the purposes of this video, we will only practice directing someone else to make the call. If an AED is available and ready to go, he will use it right away. If not, he starts CPR. Chest compressions are first. He opens the person's shirt and positions hands to pump.
1, 2, 3, 4.
He continues CPR until the person wakes up, an AED is available and ready to go, or help arrives to take over. For now, let's practice the steps for when to do CPR. For this section, put a shirt or jacket on the mannequin so you can practice exposing the chest. If you don't have one, just pretend to remove clothing from the chest. Sit next to your mannequin. If you find a person who looks unconscious, you need to find out if they are unresponsive. They could just be asleep. Tap the person on the shoulder and shout, "Are you okay?"
Hey, are you okay?
At the same time, note if they are breathing or only gasping. If the person does not respond, direct someone to call 911 or the local emergency number to get help on the way.
Sue, call 911 and get an AED.
Quickly get back to the person. If an AED is available and ready to use, then use it. If it's not, start CPR. Expose the chest so you can see where to place your hands. Make sure your knees are against the side of the chest. Place the heel of your hand centered on the breastbone. Place your other hand on top. Interlock your fingers so only the heel of your hand rests on the center of the chest. Before we add pumping, let's practice this again in real time. Sit back. Tap and shout.
Hey, are you okay?
Have someone call 911 and get an AED.
Sue, call 911 and get an AED.
Open the shirt and position your hands to pump. Okay, in the next section, we'll put this together with pumping and breathing. You're ready. You've seen and practiced all the skills. Now we'll put them together. Let's do CPR. Sit next to your mannequin. When you see someone who looks unconscious, assess the person.
Hey, are you okay?
At the same time, note if they are breathing or only gasping. Direct someone to call 911.
Sue, call 911 and get an AED.
Expose the chest. With your knees against the chest, place your hands in position. Get ready. Pump.
1, 2, 3, 4, 5,
Each
6,
pump
7,
should depress the
8,
chest at
9,
least 2
10,
inches.
11,
Then let it rise
13,
all the way back
14,
up,
15,
but keep your
16,
hands in
17,
contact with the
18,
chest.
19, 20, 21,
Get
22,
ready to breathe.
23, 24,
Each
25,
breath
26,
lasts 1
27,
second.
28, 29, 30.
Give breaths. 1, 2. Arms straight. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Give breaths. 1, 2. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathe 1. Breathe 2. Keep pumping and breathing until the person wakes up, an AED arrives and is ready to use, or help arrives to take over.
11, 12, 13.
There are a couple of special situations you should know about. Sit back and watch as we go through them. If you find an unconscious person sitting in a chair or lying in a bed, you must move them before you can begin CPR.
Hey, are you okay? Help!
CPR cannot be done correctly unless the person is lying on a hard, flat surface, such as the floor or the ground. Move the person as best you can. Protect the head so it doesn't hit the floor. Position the person on her back. Remember, CPR will not work unless the person is on a hard, flat surface. A person may vomit while you are giving them CPR. If this happens, stop and turn the person's head to the side. Use your fingers to sweep the vomit out of the mouth and throat. Then return to doing CPR. If there are 2 rescuers trained in CPR, one will immediately begin CPR, while the other calls 911 and gets an AED. The second rescuer should be prepared to take over CPR if the first rescuer becomes fatigued. Now, let's practice CPR all the way through one last time. Kneel next to the mannequin. Assess the person.
Hey, are you okay?
Instruct someone to call for help.
Sue, call 911 and get an AED.
Get back to the person. Expose the chest and begin pumping.
1, 2, 3, 4, 5, 6, 7,
Pump 30 times.
9,
Count as you pump.
11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Give 2 breaths. Position and pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19.
Depress the chest at least 2 inches and release.
24, 25, 26, 27, 28, 29, 30.
Give breaths. Position and pump.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Keep up the pace.
11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathe. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathe. And pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathe. Sit back. That was 5 cycles of pumping and breathing. Good work. Any help you provide will increase a person's chances of surviving cardiac arrest. At a minimum, call 911 and then give chest compressions.
1, 2, 3, 4.
Add rescue breaths to the pumping if you can, and always use an AED as soon as it's available.